Okay, welcome back. We're going to be talking about treatment modalities for substance-related disorders, whether it be substance use disorder, intoxication, addiction. We have treatment. There's hope. Alcoholics Anonymous is an organization designed to support recovery from people who have addiction to alcohol. It's a major self-help organization. Now that we're in this virtual realm in our world today, you can go online and attend a virtual AA meeting, NA, Narcotics Anonymous meeting, so that you can learn more about the premise of Alcoholics Anonymous. It's a peer support group. It's based on the concept of acceptance, understanding from others who have experienced the same problem, that lived experience. It's a 12-step program that embodies the philosophy or premise of AA, provides specific guidelines on how to attain, get in recovery, and maintain recovery, also known as sobriety. Total abstinence is promoted, and that's the only cure. So there is hope. The person can never safely return to social drinking, and that's what people have a hard time with, and sometimes they have to change their family support systems, relationships, peer relationships, people who may use substance around them is very challenging. So talking to them, and they'll tell you that some of the relationships that they are in are toxic to their recovery journey. So remember going to AA, getting counseling, group therapies. There's pharmacological therapy, ad abuse. When we are in week 12 simulation with alcohol withdrawal simulation, you have the opportunity to research ad abuse therapies and see other therapies that support recovery. Like I said, at Bon Secours, we use phenobarbital, which is an anticonvulsant, to support the withdrawal that happens from the alcohol substance. We used to use lorazepam, which is a anti-anxiety medication, but it's addictive. So when you're talking about withdrawal, I meant to say this earlier, but there are certain substances that will cause death during the withdrawal process that may relate to death. Alcohol withdrawal, benzodiazepine withdrawal. The addictive nature is so strong that it can lead to end of life. Now, with marijuana and opioids, you may want to die because the withdrawal is so painful, but it doesn't have the same impact on the body. So it's a little bit different way it impacts our human condition. So thiamine, we also talked about vitamin therapy and thiamine and the importance of that. You know, naloxone helps with patients who are in overdose from opioids. We teach the family members how to inject these agents because like I told you about the person who had the opioid withdrawal that led to death because of the high usage that he started back on when he was in recovery for 10 years. If the family would have had that Narcan, it might have saved life. Police officers carry that now because a lot of people, if you don't know what's caused unresponsiveness and respiratory depression, you can give that. I am. All right. So alcohol is the most widely abused drug, followed closely by narcotics. I'm going to talk to you about the chemically impaired nurse. This is not on the test, but this is just for your own knowledge because such a high prevalence, 10 to 15% of nurses suffer from a disease of chemical dependency. We have very stressful jobs as nurses, and access to um, substances. So, alcohol, everybody has alcohol, has the ability to buy alcohol, but nurses in particularly have the access to narcotics. So I want to talk to you a little bit about it. So how do you know if somebody you work with is using? Um, Sometimes they have high absenteeism. Other times, if that's where they're getting their illicit drugs, they come to work a lot, and they rarely miss work because they need their fix. So uh, the wasting of drugs, higher incidence of incorrect uh, narcotic counts, so poor concentration, difficult meeting deadlines, inappropriate responses, poor memory, recall problems with relationships, irritability, tendency to isolate, and elaborate excuses for behavior. So I bring this story to your attention because I worked with a girl in the PACU who was one of the best nurses I'd ever worked with. She was an ED nurse and transferred to the PACU, and she loved to do everybody's call. So, when you're practicing as a nurse, sometimes call can be overwhelming. So, she would take your call, and she I worked with her every day, so I had a very strong relationship with her. I knew her very well. And one evening shift, I was supposed to get off at 9 p.m., and she was going to do my call for the rest of the overnight hours. And so she went to dinner, and she came back, and she said, "Be careful because they're watching us in the bathroom." And I thought that was a strange comment. So I used my therapeutic restating technique. I said, "So you think people are watching us and use the restroom?" And she goes, "Yes, they're watching us." So I'm like, "Uh-oh, that's not okay," because that's not typical behavior. So about an hour later, two managers, by then it's 8 o'clock at night, two managers are on the unit, very unusual, and asked to take my coworker to do a project. And I'm like, at 8 o'clock at night? And they said, "Well, she's going to be gone, so you're going to have to do your call." And I was, of course, very sad about that, but I just didn't know what was happening. Well, come to find out that she was addicted to fentanyl, and they watched her in the bathroom injecting. Evidently, they had noticed some behavior, and, because we have high access to narcotics. And fentanyl was her drug of choice. When she was in the ED, they would only have 3 cc's of fentanyl. And when you're in the PACU, before this, we had 5 cc's of fentanyl. And, it's different when you're in the PACU because, say, you give 25 mics, and, you're not going to waste it every time you give 25 mics because you can give it every 3 to 5 minutes. So we would keep it in a syringe locked at our station, and at the end of our patient experience, we would go to the Pyxis and waste. And I noticed one day that it seemed like there was more medication in the ampule than usually is even in there. And she said, "Oh, I gave 25 mics." So I was like, "Okay." So, but why she wanted to do everybody's call is because she was going into the OR rooms at night after they had closed the room, and using Habistats to go into the waste buckets and get medications that way. And she was shooting them up IV, and I had no idea. So, even though with my background, I still didn't pick up on the behaviors because she was very appropriate. She had lost weight, but she said she was trying. She was cold all the time, and she wore long sleeve shirts all the time. Well, now I look back on it, of course, I realize some of these things, but I didn't expect it. So just be aware of this. It's not, like I said, on your test, but it's something that we have to be aware of. So the state board wants to help you. If you go to the state board license lookup, you can see that there are look up people's licenses, and I've done this as a manager. When you hire people, you make sure they have an active license, and if they're on probation, it's the information is available because it's public information. And I was going to hire a new nurse, and her license, she was on probation, and she had alcohol substance use disorder, and working around chemicals like narcotics, it just wasn't going to fit. So that's unfortunate, because once you have this type of record, it really impacts where you can work. And in fact, my friend from the PACU, she had to work in dialysis because, we're removing things, not adding to. Uh, uh, so she couldn't be around narcotics, and it's very unfortunate because, she was addicted. It was unfortunate. So I just want to make you aware of that. And that's why I want you to go to a closed meeting. I mean, go to an open meeting for AA, because closed meetings are sometimes healthcare professionals, doctors and nurses have a tendency to have addiction disorders just because of their access. Okay, so that concludes our time together. Please read the textbook to get more information about different kinds of substances, and have a